So what we're doing is a really exciting body of work over the next 4 years, looking at how we can improve transitions in care for critically ill patients and their families.
And what was your reaction when you found out that your application was the top ranked one?
I was shocked. I had felt pretty hopeful. We put a lot of time and effort into the grant, and we'd spent quite a bit of time, brainstorming what we thought would be the best idea, and it just, a lot of people's hearts and souls were really in that application, and then to look and see that we were ranked first was really validating.
I understand that you have some tips for CIHR hopefuls.
Yes, absolutely. So as someone who's been successful at CIHR in terms of receiving funding, and as someone who sits on the Health Services Research Review Panel, I think I have a unique perspective on what reviewers are looking for. So my first tip is to follow the instructions. So as an applicant, one thing that I really felt validated by when we received our reviewer comments was that they really noticed that we attended to all the details in the funding call. We responded to what the funders were looking for, and we included all the important components that they look for in a funding application. We also looked at the peer review criteria and what our grant was going to be judged by, and made sure that those pieces were in the grant and were really easily identified to make the job of the reviewer easier. My second tip is to start early. So I would recommend the second that a funding call comes out, that investigators start thinking about their idea, if they don't already have one, who they're going to engage, and how they're going to write their grant, and how they potentially might divvy up the work. So when we see a funding call come out, we immediately create a checklist and we delegate responsibility so that there's lots of opportunity for people to be engaged in writing and working on the grant, and also so there's lots of opportunity to revise and to refine the grant. My third tip is to build the right team. As a new investigator, I know that a lot of my success comes from having excellent mentorship, and so it's really important to explicitly state that in your grant. You want to have more experienced people who can provide you that guidance to see a large grant through. So for the team grant, we had a mix of new investigators, mid-career investigators, and more senior investigators who could all support and mentor each other. It's important also to have good co-investigators and collaborators and people to round out your team and ensure that you have all of the required skills in areas of expertise, because no one person can do everything. So my fourth tip is to take advantage of internal peer review. We're really fortunate at the O'Brien Institute that we have a very rigorous and well-structured internal peer review program. And the key to any grant is to have as many eyes on it as possible. You want people from different disciplines and areas to look at your grant, to provide you feedback, and to give you suggestions for how it can be improved. My fifth and final tip would be to keep trying. As it gets harder and harder to obtain funding from CIHR and other funding agencies, a lot of high quality grants just won't be funded the first time around. And so when you get the reviewer comments and the scientific officer notes, it's important to sit with them, discuss with your colleagues, and brainstorm ways to incorporate their suggestions to ultimately strengthen your grant. And to know that it might take a few times to multiple different agencies before you get a bite, but those comments and feedback will ultimately strengthen your grant and make for a better final product.